Hello, everyone, and welcome to this episode of the MedAll podcast. We're all about inspiring people seeking a career in medicine, inspiring those already in medicine, hearing some top tips about how to progress in your career. And that doesn't stop today. So we have Gemma Humm with us today.
Hi.
Gemma is the ASiT president, the Association of Surgeons in Training president, and she's a general surgery registrar and a clinical research fellow in surgical technology at UCLH. Hi, Gemma.
Hi, Phil. How are you?
Yeah, I'm good, thank you. Today we're not going to change our theme. We're going to continue to talk about some of those inspiring things in medical careers. But Gemma, could you maybe start off, maybe give us a little bit of an introduction to you, your career journey to date, maybe before medicine and the start of medicine, if you don't mind,
Yeah,
and then
sure.
we'll sort of go from there. What sort of things have you done to date?
Okay. Well, after my A-levels, I went to university in Liverpool. That's where I studied for my first degree, which was in orthoptics. So after that, I worked as an orthoptist in Queen's Medical Centre in Nottingham before deciding to go and do the graduate entry programme at Birmingham University. So that's how that all started.
So you didn't go straight through,
No.
you kind of weaved a little bit
Yeah.
beforehand, or...
Left at the traffic lights, I say.
Yeah, okay, great.
Yes. I actually at first I didn't want to be a doctor at all, and
Okay.
I couldn't really understand why anyone would want to be, which
Do you understand
sounds
now?
crazy. Yes, I do. Yes,
Okay.
I do, very much
Yeah.
so. And really, my interest in medicine started when I was studying to become an orthoptist.
Sure.
What I particularly found interesting at that time was the combination of learning anatomy, physiology, physics, chemistry, and actually finding a genuine application for them. So
Yeah.
and using that combination of all the different sciences plus the social sciences and the other skills that you learned, and really bringing them all together and applying them in a real world situation. And that's what prompted me to actually go and study medicine.
Was it a difficult transition? So moving from one healthcare role essentially to another, was that a tricky move?
It was a tricky move because I think it takes quite a lot of courage actually
Yeah.
to leave one really good career
Sure.
that you're doing well in, that you genuinely enjoy, and decide you're going to take this leap of faith
Yeah.
and give it up
Yeah.
and go and pursue something else. And that's a real risk actually.
Yeah.
And that was scary.
Okay.
I remember being in my first year of the graduate entry course at Birmingham, which is really tough. So that's the kind of first 2 years of medical school
Yeah.
condensed into about 9 months.
Okay.
And believe me, that put me
Tough.
through my paces. Yeah. And I remember those moments of thinking, oh, am I not going to make it? Am I going to fail?
Yeah.
Which I think is a normal process that everyone goes through. And that fear of, would I have to go back to my old career with my tail between my legs?
Sure.
But actually, I think in a way that was quite motivational as
Yeah.
well. I think it's important to know that I didn't leave orthoptics because of any negative experiences. Actually, it was really the solid grounding and training that I had in orthoptics that inspired me to learn more. So.
Super.
Mm-hmm.
Okay, so really interesting hearing a little bit about what you've done before medicine, what you've done to kind of move into medicine, and it'd be really interesting to hear about some of the stuff you've done as a doctor now. So, I mean, I know you've kind of followed the traditional path through medicine to date, but can you tell us about some of the interesting things you've done kind of along the way as a doctor?
Okay. Yeah, so I think I did a fair few interesting bits and bobs at medical school, but I would say that I was kind of a standard medical student. I wasn't at the bottom, I wasn't at the top. So, I kind of went through the process much like everybody else did, really, trying to get involved in the things that interested me, trying to get involved in the opportunities that were available to me as well. I did other things outside of medicine as well, which I thought was quite interesting. I did quite a lot of scuba diving back then, but travelling around, I enjoyed my going on my elective, which was in Malaysia. And at that particular time, I went to medical school with the first thoughts of being an ophthalmologist, which I thought made sense.
Yeah.
And I also wanted to make sure I was using my first degree in a valuable way. And then my interests really developed, actually, and I realised that it didn't matter what I was doing in medicine, actually, or even in further afield. I was always using those skills, those broad skills that I'd picked up when I was training as an orthoptist. So I always thought that was really valuable. But at medical school, I spent a lot of my time being quite interested in trauma and orthopedics. And that was why I went to Malaysia to do an elective in upper limb trauma surgery.
But you're not a trauma surgeon.
But no,
now.
I'm not. I'm not a trauma surgeon
so where
now.
you're general surgery, aren't you? So
yes,
colorectal surgery, perhaps more specifically.
Yes.
But where does that come in?
So where did that all kind of happen? Actually, so it's very interesting. Actually, I found myself always very interested and inspired by the people that I was working with, by the opportunities and the experiences that I had, and it very much felt that when I was at medical school, I was spending much more time in the orthopaedic department. Those surgeons were really interesting and really inspiring. They got me involved in research projects, audits. I met a really inspiring female orthopaedic surgeon.
Okay,
she was just great. She did this kind of complex limb reconstruction frame surgery, and she was really cool. So I spent a lot of time hanging out with her, which was really beneficial. And then I went to Liverpool, actually. So I went back to Liverpool to do my foundation training. And that was fab. Again, spent quite a bit of time in orthopaedics there as well, but was they'd all kind of, my interest changed a bit when I did a general surgery post. And that was in my F2 year, and that was at Aintree Hospital. And they have a really big emergency general surgery major trauma unit. So that was what really sparked my interest. And I think at the time, the kind of development process was from the trauma and orthopedics side going into the kind of emergency trauma general surgery side, I think was a natural progression. And then when I went further into my core surgical training, I spent a lot of time in colorectal. So I think for me, it's been a progression of the experience that I've had as well.
Sure.
Okay,
that's really interesting. And one of the more interesting things you've done recently is become the Association of Surgeons in Training president. Can you tell us a little bit about the Association of Surgeons in Training? What is it?
Sure.
What does it do? What does the president do?
So, well, I think the first thing to say is that I didn't start as ASiT president.
Sure.
So ASiT is a really, really interesting organisation. It's an independent professional body and educational charity for surgeons in training, as the name suggests. We represent nearly 3,000 surgical trainees who are our members, and they're trainees that are from medical student right up to the way to the end of their training across all 10 surgical specialties. And that's a really, really broad mix, really, really broad mix of both stages of training and, of course, special interest too. Now, principally, ASiT is involved in, well, one side is independent trainee representation at various educational and training committees, and the other side is about providing value for money educational opportunities for surgical trainees who are already on established training programs, but also those who are perhaps in the bit more junior stages of their career or are branching out and trying to find out a bit more about surgery. What is surgery about? How does it work? How's the training work? What sort of surgical specialties are available? So really giving people an opportunity to find out more about surgery and whether or not it'd be something they'd be interested in.
Super. And What did you do previously when you were in ASiT? You didn't start as a president, you said.
No.
So,
So when
how did you get there?
when I was in my first year of core surgical training, I applied to be the Eastern Regional Representative.
Okay, so the regional representatives all over the UK. Yeah.
So regional representatives and also then specialty representatives. So I was Eastern Regional Rep, and then
I was saying that like I didn't know what ASiT did, always, but I do. So it's kind of a probing question. But
yeah.
Okay.
And then must have been towards it was in CT2. So CT2, then I was elected onto the executive committee as honorary sec. And so the executive committee, which is part of ASiT Council, is made up of probably about 13, 14 individuals, all have quite specific roles that are all concerned with running the organisation itself. The Honorary Secretary looks after the sponsorship side, and so was my job to raise funds for ASiT to get the trade exhibition together for the conference, and generally just really really building and establishing mutually beneficial relationships between industry and educational partners and the association in order to provide better opportunities for our members. And I did that for 2 years, which was really, really great. Learned an awful lot doing that. And then was elected as president. So
super.
A year ago, yeah.
Nice natural transition.
Yeah.
Super. Okay. I've got to ask a slightly more difficult question.
Okay.
Don't look too nervous. But surgery is often seen as a male specialty in inverted commas. I mean, is it still like that? What steps have been taken to make it more inclusive? And is there still more to be done? What can individuals do to make it more inclusive? And what can organisations do to make it more inclusive?
That's interesting. I think, for many years, surgery, and I mean surgery in the broader sense, has been considered to be a male-dominated specialty. Like there are other jobs, other professions that are also considered to be male-dominated. I think really there's a lot of interesting cultural changes that have been happening over recent years and are still continuing to happen as well, that are really breaking that stereotype and breaking that barrier down. I think the important thing is that actually we stop viewing them as male-dominated specialties, interests, professions or jobs, and realise that they are actually just opportunities for everybody to get involved with. There's been lots of interesting work that's been going on about encouraging both women into surgical specialties and people from other backgrounds, widening participation within medical schools and other special interests as well, all of which I think are equally valuable. Do I think there's more to be done? I think probably there is. I think that's fair to say. We notice now that although more than 50%, isn't it, of medical school, medical students rather, are female. They are not as well represented in the higher.
So we're not seeing that come right through.
We're not seeing it come through just yet. So, and I don't think it's not just surgery that happens in. I think it's also in other professions too. It's in academia as well. We're only seeing a very small number of, and we're talking about women specifically for the moment, but only a small number of women reaching those kind of real senior jobs and roles, and I think that is multifactorial, and I think we can pin that on anything. But I think the more we see women, for example, in these roles, I think there's more opportunities for girls and women to aspire to them.
And you're doing some interesting things with ASiT as well, aren't you? So, I mean, we're in Belfast at the moment. You might tell from the Best in Belfast sign on the wall for your conference.
That's right.
And you're doing some interesting things to make it easier for everyone to be a surgeon at your conference.
That's right. So at ASiT, we feel really strongly about making sure that all of our opportunities are open to absolutely everybody. We, for this time, are trying to make our conference much more accessible and family friendly. So for the first time, we have got a free daytime crash at the conference. We also have a nursing room, which is a live stream from the main plenary into the nursing room. So nursing mothers can breastfeed and not miss out on the conference itself.
And are there any other conferences in the UK or Ireland that are doing that?
So I do not think that there has been a surgical conference in the UK or Ireland that has had a free daytime crash before.
So that's fantastic, isn't it? So a trainee organisation kind of leading the way in
yes.
that sort of inclusivity, with them being the first in the UK around, potentially. We're not sure. Don't quote us on that.
Yeah,
but,
I think so.
Potentially.
But I think so,
That's incredible. Okay, super. And you said it's kind of for everyone as well. So it's not about seeing this as a specialty for males or especially for females even, but especially for everyone. And I know we kind of chatted beforehand about ways in which we could do that in society as well. And we're talking about education, and you had some thoughts actually about educating not just young girls that they can do things, but
well, I think that's it. I think it's about breaking down these barriers about these roles and starting from early on. If it's from day one, in fact, this education needs to start at home, in schools, and following through. And it's not just about telling young girls and women that they're capable and these opportunities are available to. It's about educating young boys and men as well that these aren't gender-specific roles or posts. They are just opportunities for everybody.
Sure.
So.
Awesome. Okay, so you've done some really interesting things so far. I mean, you didn't go straight through into school. From school into medicine. Even within medicine, you've done some interesting things. So you're a PhD student at the moment.
That's right.
And you're the ASiT president. What sort of things do you think junior doctor, an F1 or an F2 needs to be doing to get exactly the job they want in the specialty they want, surgery or otherwise? And any tips on getting some of those things?
Yeah, I think so. I think it's important to have an idea of what you would like to do, what your interests are. I think it's probably even more important to have a much more of an open mind approach to the way you look at your training, look at the experiences that you seek out. My plan, if you remember all that time ago, was to be an ophthalmologist, and now my plan is to go into colorectal surgery. And if I'd have been really, really staunch on that first plan, I wouldn't have had these incredible, enriching experiences that I've had along the way.
Yeah.
And it's because I've had an open mind, because I've sought out opportunities, experiences, and when these doors open, you walk through them. Yeah. Even if you think, well, that's not really what I was planning. Well, actually, it's a really good opportunity, so go for it. Even if you think, oh, that's really scary. I'm not sure would I be able to do that. That sounds really hard. Well, just do it. Just do it.
And kind of see where it goes.
Yeah, absolutely. Because it's all about the different skills and experiences that you have along the way. I didn't think I would be, managing industry partnerships, making negotiations on deals. It's not because I arrived at ASiT with an MBA or a track record in running a business. It was because somebody said to me, "Joe, I think you should give this a go. I think you'd probably be quite good at it." Yeah. And just so happened that worked out. Yeah. So.
And then you kind of progressed into your current role. So you walked through a door that opened, and here you are. Okay, that's awesome. And then can you tell us a little bit about the PhD? Are you allowed to tell us about the PhD?
I can talk about the PhD.
Can you tell us a little bit about what you're doing with it? It's quite innovative, isn't it?
Yeah, so it's really interesting actually. So I am looking into ways that novel digital tools can influence both training and the precision of surgery. So I'm kind of concentrating on colorectal at the moment, most likely probably rectal cancer, rectal cancer surgery rather, and looking at the novel digital tools of artificial intelligence and also interesting imaging systems really, so virtual, augmented and mixed reality, and how that can support our training and the service that we deliver.
And it sounds incredible. It sounds really groundbreaking stuff. I mean, how do you go about finding those opportunities? How do you find and how do you get an interesting PhD?
Do you want to know how I found about that one?
Go ahead. Twitter, okay.
Yes.
Wow.
So my boss tweeted about this opportunity, and somebody else I know sent me a screenshot saying that looks like a really good opportunity.
So you kind of heard it through the grapevine, essentially.
And I wasn't. I mean, at that particular time, I was starting to think, do I want to do a PhD? Do I want to look into research? Maybe I do. Don't really know what it's about. Don't know how to go about it. Don't know how to find one. Because that is a bit of a minefield. And then someone said, hey, this sounds like a really good opportunity. I think you'd be quite good at it. There's a theme, isn't there?
Yeah, for sure.
So I thought, oh, do you know what? I'll go for it.
You walked through the door?
Yeah, I walked through the door.
If you were to do it all again, so if you were to say to Gemma Humm 2, 3, 5, 10 years ago, what advice would you give yourself?
So I think, again, it's that open-mindedness. I didn't really realise that's what I was doing at the time. And sometimes I wonder, with the benefit of the retrospectoscope, how many opportunities I missed out on.
It's not a surgical instrument, is it?
No, you don't. I would just wonder, actually, how many opportunities maybe I did miss out on because I didn't put myself forward. So what I would tell my old self is have much more confidence in putting yourself forward for opportunities, whether they are seeking something out that's a bit off the wall, like following up a tweet for a PhD, for example, or if it's thinking that registrar's got quite a cool research project, I'd quite like to get involved. Well, ask. And have the confidence to ask, because I'm fairly certain that registrar would be really keen for some help and would really love to teach you how to do that piece of work and how to grow. It's the same with my kind of clinical work and opportunities. You'd say to that registrar, can I go and clerk that patient instead of being the scribe? Or going to theatre and saying, boss, I've seen you do X number of this operation now. Would you train me to do the first bit, for example? And I think if I'd have had the confidence to put myself forward for more opportunities, actually, who knows what more I could have been doing.
Sure. Are there better people to ask to get those opportunities from? Do you think we should be asking everyone at every opportunity, or what do you think?
I mean, that's always a challenge, isn't it? You need to. I very much feel that part of our training is developing an insight into the situations that are around you. You need to be able to gauge the room and gauge the situation.
A little bit of social intelligence.
Yes, absolutely. Absolutely. You need to know when's the right opportunity. And believe me, I'm fairly certain I'll have asked some of the wrong times as well. And I think that's all kind of part of the process too. I think none of this is in a book. And maybe I should write one, I don't know. But it's all about making use of the wealth of experience and knowledge that is around you. Your medical student colleagues will know about stuff. Your foundation colleagues, your core training colleagues, your registrar colleagues will all have loads and loads of tips and tricks. They'll have projects up their sleeve that they're working on. They'll have, someone once told me this pearl of wisdom once upon a time. And those are really the best ways of getting the advice. All of the big decisions that I have made and all of the big opportunities that I've come across I've found because somebody I know has suggested that or encouraged me to do it, or I've chatted it through with them over a cup of tea or a glass of wine.
So it's as much about people
absolutely
as it is about anything else. Yeah,
absolutely.
Okay. That's really interesting.
But that's the whole ethos of what we do in medicine, isn't it? This isn't about kind of personal gain or climbing a greasy pole. This is about getting good skills, get a good experience, and in order to translate that to better care for your patients.
Okay, so we've talked a little bit about your career. We've talked a little bit about ASiT. We've talked a little bit about making medicine inclusive. I've talked a little bit about how we get some of the stuff that we just need to do, but do it in a really interesting way that actually makes a difference, and how that's kind of what medicine's all about. Where does collaboration fit into that? I mean, we talked before we did this podcast even about your PhD and some of your the interesting people that you're working with, and how that's a real team effort. Where do you see that fitting into career progression in medicine, and actually just getting some of the projects that we need done, but doing it to a high standard? Collaboration, what do you think?
I think collaboration is crucial for the success of medicine, surgery, technology, and probably most of industry, to be honest. I think we're all really well trained, educated, and experienced people, and in various different little pockets, interesting skills, mix of skills, but actually really for us all to progress, I think we need to work together and merge them together. I think there's probably pockets of people who are great with ideas but don't really know how to implement them. There'll be other groups of people who have got loads of skills on making stuff happen but perhaps don't have as much experience with the context or the application. So really, it's, in a very simplistic way, it's bringing those two teams together to thrash out whatever idea it is they have and move it forward.
And you've been, even in your term as ASiT president, you've kind of made some interesting moves with regards to that.
Yes.
Can you maybe tell us about some of those things?
It's fantastic, really. It's an idea that I've had for a while, really, working with getting groups of people working together collaboratively. ASiT is running in parallel with its conference this week the first pan-surgical innovation hackathon.
Great.
So we have got probably about 50 people in total, maybe just shy of, but a mixture of medical students, surgical trainees, engineers, data scientists, computer scientists, who are all going to be split into small teams to work out, think of a problem and then thrash out a solution.
Try to solve it.
So I'm really excited to see what's going to come out of it.
That'll be really interesting, actually. Maybe we should catch up in like a week's time.
That would be amazing,
and see some of the interesting things that have come out of that. And it's really not about locking a single person in a room to come up with an idea,
no.
is it? It kind of was work. So you mentioned loads of different disciplines that are kind of working together. And
that's just to name a few, of course, but it's...
And both outside of medicine and within medicine as well, so different grades, different skills.
Yes,
doctors with different experience. That's really interesting.
And what's really great within, if looking at the list of delegates that are coming to the hackathon from the medical side, as it were, we've got medical students, we've got consultants. Now, how marvellous is it that in that environment, those people from either end of the kind of seniority or hierarchy, whatever you wish to call it, are going to come together to work on a project on a totally equal footing.
Yeah.
I think that's really, really progressive, particularly for medicine.
Yeah. So it's equal with different skills, really, isn't it?
Absolutely.
So, some consultants, we probably can we say this? I don't know. But some of them might not be as tech savvy as some of the medical
Perhaps
students.
not.
That's probably a polite way of saying it. But equally, they'll have huge in-depth specialty skills, wouldn't they? So.
Of course. And I think what it is that with such an event, everybody who attends has got something valuable to bring to the table, and everyone's equal in doing so.
Yeah.
I think it's really interesting because perhaps there might be people out there who are thinking, oh, maybe I couldn't do that because I'm a medical student, maybe feeling a bit shy or not confident about that. But actually, sometimes it's better that we have people who are less experienced with hospital medicine, for example, who can bring a fresh pair of eyes to the problems that us old folk now, are facing every day.
Yeah.
Actually, I really would love to hear what the younger generation have got to say on this.
And I mean, what responsibility do we have as slightly more experienced doctors, and what the really experienced doctors, consultants? What responsibility do we have to actually implement those as well? So it's really nice to hear a medical student come with fresh eyes as well, isn't there? But do you think there are problems in medicine sometimes in implementing those ideas, and are there ways in which we can kind of overcome that?
Yeah, there's lots of barriers to change across the board at the moment, isn't there? I think as the kind of middle grade cohort, I think we have a real responsibility, because even if you think of the traditional hierarchy within medicine and within the firms, the whole point is, say, the registrar is the go-between between the juniors and the boss, isn't it? Yeah. And I think even if you take that traditional registrar role, I think that still applies, because as the registrar, it's your responsibility to teach, guide, encourage and inspire your junior staff, and at the same time learn and bring that all around to make sure that everyone's working together cohesively as a team. So I think the same thing applies. If you find that there's a medical student or an F1 who's got a really good idea out there, then say, well, that's great. Let's talk about your idea. Yeah. Okay, you might not know a great deal yourself on an individual level how to take that idea forward, but there's no reason why the two of you or three of you, four of you can sit down and start making a plan, thinking about how it's interesting. There's lots of different avenues to pursue. If you think there's the clinical entrepreneur program, for example, innovation is really, really important at the moment. It's a hot topic. They're interested to hear innovative ideas. So there's lots of different platforms out there to pursue. I think the more we talk about it, the more the ideas will grow.
I mean, it's kind of becoming, if you were to rewind the clock to 20, 30 years ago, and I don't know this, I'm kind of ad hoc talking, but I don't think the NIHR academic clinical fellowship programs existed. And that kind of integrated academic training in a formal sense was really groundbreaking, and has, really instilled some excellence in academic training in clinical medicine. And do you think there's a role for some of that sort of stuff in innovation and entrepreneurialism? What do you think?
Yeah, definitely. I think the more we encourage individuals to think about their ideas, think about the problems we face, the more likely we are to find solutions to them. The more opportunities do we have to collaborate with other disciplines, as I was talking about a little bit earlier on, the more opportunities we'll have to find solutions. Yeah. It's very tempting to come to work today, every day and moan about the things that are going wrong. Yeah. And Lord knows I've been guilty of that, of course.
You're not the only one.
Some days it is difficult not to. But there are opportunities. And even if you think about how things were maybe even 2 years ago, 3 years ago, so that's a really short period of time. The interest in innovation now is far greater than it was a couple of years ago.
Sure.
So I think these opportunities are just going to grow exponentially over the next few years.
Okay, so we've had your whole career journey essentially in a matter of minutes. So I think we've probably left a few things out, but. If you were to give some advice to an aspiring surgeon amongst school pupils, amongst medical students, amongst junior doctors, what would your message be to those people?
Well, ultimately, it's find out more, talk to people more, seek out opportunities and experiences, and ultimately, if that's what's interesting you, just do it. Okay,
so 3 words: just do it.
Just do it.
Just get on with it and
do it,
and go for it. Yeah. Okay, that's
brilliant.
That's really inspiring. Super. Listen, Gemma, it has been an absolute pleasure.
Thanks, Phil.
Having you here today. It's been nice to catch up. It's been great to kind of hear some things that I didn't know about you before. and I really hope some of that provides some inspiration to others to continue to try to progress in their career, to do some interesting things, to innovate, to work together. And I'm sure you will have inspired a few people out there. Thanks so much.
Very much. All the best.
And all the best for your conference this weekend.
Thank you. Cheers.